To Surgery Squad's virtual ingrown toenail removal. I'm Dr. Jeff, and I'll be guiding you through this procedure today. An ingrown toenail happens when the edge of the toenail grows down and into the flesh of the toe. When this occurs, there is usually a moderate amount of pain, redness, and swelling around the toenail. An ingrown toenail is usually caused when extra pressure is applied to the toe due to shoes that are too tight or too loose, improperly trimmed toenails, foot or toe deformities, injuries, and fungal issues can also be contributing factors. There are some ways to treat an ingrown toenail at home to relieve some of the pain, but remember that you should never attempt to remove an ingrown toenail yourself. If you're a diabetic and have an ingrown toenail, it is recommended. Now that you understand the causes of an ingrown toenail, let's put on our gloves and remove one. Our patient is ready, so let's begin by disinfecting the toe. Now, we need to numb the toe with a local anesthetic. We'll have to inject the anesthetic in several locations around the toe. Great! Now we'll wait a few minutes for the toe to get numb. Now that our patient's toe is numb, place the special tourniquet around the toe. This will help reduce the amount of blood coming from the wound. Once you've done that, first, carefully slide one blade of the nail anvil under the affected nail. We're going to go down the nail until we feel a little bit of resistance. Our patient's going to feel some pressure as we cut away the ingrown nail. Great! Take the forceps and carefully remove the ingrown nail. It's getting kind of messy in there. Let's clean up that blood. See that small bit of pale yellow substance right there? It looks like the patient has a bit of infection in the toe. Firmly squeeze the edge of the toe to get as much of that toe is starting to look much better, but we're not done yet. Next, we're going to apply some phenyl acid to the wound. This will help ensure that the problem of ingrowth will not reoccur in this. When you're done inserting the acid, I'll remove the tourniquet and we'll finish up. Finish by applying some antibiotic ointment on a sterile. Place it against the toe and wrap it in a gauze bandage. Fantastic job! Since there was some obvious infection, our patient will be sent home with a prescription for some antibiotics. We'll also need to tell our patient to keep the wound dry. Clean the wound regularly and replace the bandage 2 to 3 times a day. While our patient's toenail isn't likely to regrow, his condition is likely to return if he doesn't take care of his feet. This includes wearing proper fitting shoes, properly trimming his toenails, and keeping his feet clean and dry. And that's how we remove an ingrown toenail. You did a great job today. While you're here, try your hand at one of our other surgeries here at surgerysquad.com.